Unfortunately, I have to start today's briefing by reporting 5 new people passed away last night. A man in his 50s, a man in his 70s, a man and woman in their 80s, and another woman in her 90s. So my condolences and prayers go out to the 5 families and to the other 161 people that just lost someone in general through these difficult times, these last 9 months that we've been in. So it's not an easy time. It's not an easy time to lose anyone. But it shows you the seriousness that we're in, and Dr. Whalen and I have talked about time and time again, of the situation, of where we're going and where we're headed. And it's only going to get worse for a while before it gets better. And we do need everyone out there just to continue. The people doing the right thing, thank you. Thank you. I sincerely mean that from the bottom of my heart. To the people that just think it's fake, or not doing the right thing, or don't want to wear a mask, just help us get through this. And we continue to do the right thing. We will get through this. I know it's been a long 266 days. And since our first news conference, Dr. Whalen and I had back on March 12th. And it's going to be a longer 2 more months. So I'm saying to everyone out there, please, please help us get through this. And I know we can get through this. And I keep saying the light's at the end of the tunnel. And we're there. We're this close. We're this close to the end. And just because the vaccine's coming out, and Dr. Whalen can talk about that, it's going to take a while. It's just because we're getting 170,000 vials on March 10th, which is great news, doesn't mean that it's going to get out to everyone in New York State. She can talk better on that than I can. But that's 15 COVID deaths in just 1 week. This is the 3rd day in a row I sat up here and I had to report new deaths from overnight. And it's not, trust me, it's not getting any easier sitting here and talking about somebody that passed away. And it's not easy for the families. So my heart bleeds more for the families than for myself. But as of today, we have 6,160 positive cases of the coronavirus in Albany County to date. 2,239 people are currently under mandatory quarantine. That's an increase of 137. As of today, there's 24,509 people that have completed quarantine. 5,250 tested positive for the virus. Out of that, 116 recoveries since yesterday, which is good news. The number of residents currently in the hospital because of the virus has once again gone above yesterday's record. There are now 90 people currently hospitalized from this virus. Yesterday it was 84. That was an increase of 15 new hospitalizations overnight, but also it was a discharge of, I believe, 9 patients overnight, but we gained 15. So it's alarming the amount of people, yes, they're coming out, but the amount of people coming in. So it's something that we continue to look at and we've talked about in the control room meetings. But the number of people in the hospital right now from the virus has more than doubled in just 1 week. Just to put it in line, has more than doubled in a week. I want to highlight that it's not just older residents who are hospitalized, what some people may think. So again, we have 1 person younger than 25 years of age that's in the hospital with COVID-19. We have 15 of those hospitalized between the ages of 25 and 49 years old. And 37 between the age of 50 and 74 years old. And there's just as many people currently hospitalized between the age of 50 and 74 as there are age 75 years and above. Our hospitalization rate was 1.46% of those who have been tested positive. Yesterday, that rate was 1.39. And unfortunately, we have 14 people currently in the ICU. That number was 12 yesterday, so I'll take 2 extra people in the ICU. This is the highest number of residents in the ICU since April the 13th, when we were at 16. So while it's true that our hospitals are better able to treat people, and there's new treatments out there to address this issue, that less people are being put on ventilators and people are staying in hospitals shorter periods of time, which is all good news. But the uptick that we're seeing is very, very alarming. We have not seen the full effect from Thanksgiving. Probably from Halloween we have, but not from Thanksgiving. So going into the next couple of weeks, it's going to be very, very alarming. So that's one of the things we have to talk about. As treatment improves, we're dealing with the numbers we haven't seen before in the last 9 months, the amount of numbers we're dealing with in hospitalizations. Over the last 5 days, there's been an average of 131.6 new positive cases each day. That was way above the 117.6. And while the situation continues to get worse, we get some good news that DOH announced yesterday that New York will get, again, 170,000 COVID-19 vaccines by December 15th. And I talked about the CDC and the recommendation they made. It's going to go to nursing home settings and workers like that first and foremost. And it's going to take time. And it is critical that this vaccine goes to our most vulnerable residents and populations that were hit it the hardest. And I know that that's what DOH is going to address. I know there's issues that we addressed on the county level, and we will continue to address. But I do want to remind people it is going to take time. I think they said yesterday, you know, we're looking at in some cases May to June, maybe even September before everyone gets vaccinated in New York State. And what's going to be alarming is that as we do this going forward, people are going to feel more and more liberated, like, oh, I don't have to wear a mask, we can start socially gathering, everything can be full open. And again, Dr. Whalen can talk about this better than I can. It's going to take time, and we're going to be in this for a while. So please pay attention. So nothing's probably going to truly happen to the summer of 2021. Again, I hate putting dates out there, and I would love for the media or the Times Union to prove me wrong. And I want to be wrong. I look forward to that article. The county executive was wrong. It wasn't 2 months, it was a month. That's okay. That's a problem I like to have. Not a problem of breaking records like we did in November in the direction that we're going in. Because, again, it's hard on all crucial workers, essential workers that have to go out every day. And even the workers that are back, it's tough on everyone heading back into this direction. And continue to stay at this pace that we're at. But it's here, and we have to stay vigilant, and we have to stay strong, and we have to be there for one another. But looking at our percent positive rate, Albany County 7-day rolling average now hits 4.7% using the data from December 1st, the latest availability on the state dashboard. And again, you can go to the state dashboard and get the same information and pull up county by county if you want to. Our daily percent positive rate hit an alarming 6.4 on Tuesday, which drove up our 7-day average. This is now the 3rd day in a row our percent positive was above 4%, which technically would put us past yellow into orange. The 6th day in a row that we've seen above 3%. And some of the things we're still working on, which we said, and I wish I could clarify it, we're still waiting on guidance on the microcluster zones. We're waiting on guidance for the 5 new initiatives the governor's changed. And once we get them initiatives, we'll know how this is going to affect going into whatever zone we may go into or matrix, be it yellow or be it orange. And I know it has a lot to do in the hospitalization rates, bed capacities, which we said yesterday, and personnel at hospitals to perform their duties, and not just ICU beds. So that's all calculated into that. So when we get that guidance, we'll put it out to everyone. But some of the things I want to point out, yesterday in the U.S., recorded not only its all-time high of hospitalizations at over 100,000, but also recorded a number of COVID deaths a single day at 2,760 people that passed away from COVID-19. This is likely a sign of things to come, and the CDC is now predicting that the next 3 months will be the worst we've ever seen. And they're predicting another 120,000 could possibly die from the virus. The head of the CDC, Dr. Redfield, fears that this could not only be the most challenging time during the pandemic, but the most challenging time in public health's history. I also want to remind everyone that we still haven't seen the full effects of Thanksgiving and the infection rate, but likely we'll see it in the next week or so. Yes, I'm trying to brace everyone for the worst case scenario and what we're seeing coming down the pike. Not trying to scare people. I'm just trying to wake you up and, again, realize what this is going to look like the next couple weeks. You can help us do our job if you do the right thing and wear a mask, cough into your arm, clean your hands, and stay 6 feet apart. And we'll get through this. And watch the clusters at your house with family gatherings and stuff. People come over, make sure they got a mask on, keep the 6 feet. We're not telling you not to have people over. We're just saying do it smartly. Do it smartly. Someone stops by your house, just keep the 6 feet distance. They want to come in your house, that's your call. But do the right thing, and we'll continue to get through it. I know with the colder weather, it's making it more challenging for people to not be outside. You know, it's colder to stay outside 6 feet apart. But please help us get through this. Dr. Whalen?
Good morning. Like the county executive, I wish the news could be better, but we do continue to see our case numbers going up, and we continue to urge caution to the public. We are heartened to know that there will be vaccine coming into the state shortly, but again, this vaccine is not going to be for the general public. We had a call with state DOH yesterday on how the vaccine will start to be distributed, and as we all know, the likely first candidates for the vaccine will be our hospital providers, our frontline workers who are working daily with COVID patients, and our skilled nursing home facilities. These are the highest risk individuals, and this makes sense from the perspective of how to allocate the limited resources that we have. The vaccines will likely go straight to those individuals, straight to those institutions, and we will alert everyone as we hear more about that. But the important message is that although this is the beginning of a light, for the general public, there is likely a much longer delay in when vaccine will be available. And until vaccine is taken by the majority of people, it will not be protective for the community at large. So it's essential to continue and to embrace, if you have not so far, taken seriously public health measures, to start now. If you are waiting to make plans for Christmas thinking things might get better, I urge you not to do that. It's not going to get better in any likelihood between now and Christmas. It is likely that we will continue to see cases increase, and that this will result in increased hospitalizations and, unfortunately, increased deaths in the county. The only way that we can prevent this from happening is through individual behavior. What does this mean? Again, learning what we're learning about the epidemiology or how this disease spreads and what are high-risk scenarios. We are learning that gatherings in the home with individuals that are outside your immediate family are a risk. So if you are inviting people into your home that don't live with you every single day, you're taking a risk. We all know that we like our extended family to be around. We believe our friends, may not harm us, and no one's doing anything intentionally, believe me. People, unfortunately, which makes COVID so frightening and so difficult, can spread COVID if they are asymptomatic. So it is essential that you limit your household to just your household members and not have gatherings within a home thinking that if you just have a few people over, the risk isn't there. We are seeing many cases in the community. We are seeing cases across all facets of the community. So, people like to say, where's the highest number of cases? And is it in my neighborhood? And if you gave us a better indication of where we are seeing the highest number of cases, then I would know it would be safe to do A, B, and C. The answer right now is that given the spread we have in the community, your risk is high every time you walk out the door. And you need to protect yourself, and you need to protect your family. If you are able to assist those that you know that are at high risk with things like getting groceries, start to do that. If you have elderly relatives, if you have people that or you're concerned about being out and about, look at ways that you can help them by limiting their exposure to other individuals. If you are out in the community, again, masks are essential, but they are not the complete answer. They need to be utilized with social distancing. So keeping your distance is essential as well. Avoiding places that are crowded is essential. And of course, washing your hands when you have been out and about is essential to preventing disease spread. All of these things have to be taken together. But I really would encourage the public to start thinking about canceling travel plans that they may have in the immediate future. This is not just an Albany County problem, but it's a problem across the entire country. And across the country, we're seeing hospitals hit their surge, and that is what we really want to avoid. So any high-risk behaviors like traveling and inviting people into the home, going to large crowded areas should really be cracked down on. We know this is incredibly difficult advice any time of the year, but especially around the holidays when people want to get together. But what we're trying to do is enable people to be sure that they're going to be able to do this next year. Every day we're losing people, and we want to prevent this to the extent possible. We want to keep our numbers in a manageable fashion so that there is not capacity problems. Our case investigators are very challenged now to get information out to the public, and we are looking at ways we can streamline our work on a daily basis. We're working with the state DOH. We held a call yesterday with state health commissioners or county health directors and commissioners across the county, and we know we're not alone in our challenges. This is across the state. I did want to mention that we continue to work with Whitney Young. Were you going to mention that next?
Go ahead.
Okay.
We
continue to partner with Whitney Young Medical Center on Whitney Young Health Center on testing of symptomatic students, and they have been doing a great job in working with schools to get kids that are symptomatic and excluded for testing. However, we've decided to change the protocol, and we have done this to streamline the testing. And what the decision has been is to take the rapid testing off the table because we're getting feedback from parents and others that it's difficult for kids to get the rapid test and then go forward and get the PCR test. We understand that for kids, and it will enable them to test more individuals. Also, we haven't had a high yield of positives with the rapid test, and luckily most of the tests that they have done have also been negative. But to be able to get one test will be easier. So they are going to continue to do the testing, but they will be eliminating the rapid testing. This process will remain the same. Parents are advised to contact their school nurses if they want to get testing at Whitney Young. The school nurses will provide the information to Whitney Young, and Whitney Young will reach out to an appointment, to the parents for an appointment. So we just wanted to let you know that this is one of the ways that we're, looking to streamline the workflow and hopefully make things easier. We do know that as the epidemiology of COVID evolves, we are learning that the K through 8 classrooms are less likely to be areas where we are seeing spread in the classroom. So I know that there is commitment on the state level to trying to keep the K through 8 and K through 12 students in place. We learned a little bit about the changes in zones. There will still be mandates around testing for asymptomatic students and staff that are working in the schools. And this will be with rapid testing because, again, rapid testing is okay for asymptomatic screening, but is not adequate for rule out of disease in symptomatic individuals. So we are preparing and still working with our school populations to ensure that we have capacity with them to do this testing. And we will continue to work on a daily basis, update the public, and continue to share important messages with you going forward.
Thank you, Dr. Whalen, and I appreciate all the work that you're doing at the Department of Health to get us through this, and to all your staff, and to everyone out there that's helping us get through. Thank you. Whatever your job is out there in this world, thank you for what you're doing, keeping everyone safe and the people you work with safe, because that is important. But also, I'm glad that you brought up Whitney Young. We are having the testing available at the Times Union Center tomorrow between 1 p.m. and 4. Free parking is available at the TU. So please call the Whitney Young and set up an appointment. We'll be inside, to be out of the elements. So please come down and get tested, and you can get free parking. So we're encouraging people to have symptoms or not to get tested by making an appointment by calling 518-465-4771. And again, we cover the cost if you don't have insurance. Albany is also free too. Thank you to the state for that. And that number is 1-888-364-3065. And again, there's so many places out there and opportunities to get tested. And we are trying to push a new initiative to get more testing sites out there, more availability for people, and we'll be rolling that out hopefully in the next couple of weeks of how we're going to try to address to get more people tested. And again, because the vaccine's not going to be here for a while, so I know we'll be here, and I know everyone's going to be happy it's coming in the next week here in New York State, but it's going to go to the vulnerable residents first and foremost, and to people in underlying health issues in other areas. So please be patient with that. But you can go to albanycounty.com. You can look at the website. You can get testings for rapid for kids. If you just want to get the antibody testing done instead of the whole testing done. Variety of places. Take advantage of it and get checked. And please, be patient. Be patient. The people that work there, just like Dr. Whalen's team at the health department, are just trying to do their job. They're just trying to do their job, and it doesn't help if you're irate and upset, and we know people are getting upset, and they want answers. Take a deep breath. Like I said, it's a marathon, not a sprint. Step back and realize, put yourself in their position, just like if you see someone not wearing a mask. I tell people, don't challenge them if you don't. Walk away. There's no reason. You can't argue with someone that doesn't want to educate themselves or just believes in whatever they believe in, that this isn't a bad virus. Just choose to go to another establishment or just walk across the street. But anyone that needs mental health support, please call it. It's available 7 days a week from 8 a.m. to 5 p.m., 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. 211 in the New York State hotline, as always, is available for anyone that needs it. And again, it's the mental health, not just for adults, it's for children too. Please, parents, guardians, anyone, that your nieces, your nephews, your cousins, take an opportunity to talk to them. The world's different for them. They may not, some might show it and some might not show it, but, take that opportunity to have that deep conversation with your kids, because it's more important today than it's ever been in their life. And it can make a difference in the outcome of how they're handling the whole situation around them. Again, to the 5 families that lost loved ones, our condolences and love go out to you in our prayers. And to the other 161 families, again, you're in our thoughts. And to anyone that's lost a loved one through these difficult times.